Hey guys, I'm presenting on my patient, Mr. Meng. He is a 38-year-old male. He had a physical for his job, and the physician noted an enlarged liver and elevated liver enzymes, so he was referred for an evaluation. He is currently asymptomatic with hepatomegaly, which is an abnormally large liver, and elevated ALT and SAT that was documented 6 weeks ago. He has no significant medical or surgical history. He takes no medications at home. He uses tobacco and occasionally uses alcohol. His mother has diabetes and his father has hypertension and coronary artery disease. He is in no apparent distress and he is overweight. His temperature is 98.7, his pulse is 77, and his respiratory rate is 12, which is all normal. His blood pressure is a little elevated at 142 over 86. His height is 5'8". His weight is 205 pounds. His skin is warm, dry with no jaundice. He has a firm liver with a prominent left lobe and spleen tip with no ascites, masses, or tenderness. The ultrasound concluded that the functional tissue of the liver is um, is decreased, and there's no pretty much what this is saying is that there's no masses or tumors or stones in the liver. And his flow velocity is 42, and that's normal. His gallbladder is okay, and his spleen is enlarged. Um, he was diagnosed with hepatosplenomegaly, which is the enlargement of the liver and spleen, and hepatic steatosis, which is non-alcoholic fatty liver disease, and hyperlipidemia and hyperglycemia was noted. So his treatment plan was repeated labs and ultrasound in 6 months, and he was referred for weight loss and nutrition interventions for NAFLD. Um, For his dietary intake, in the morning, he has coffee with sugar and milk. At work, he has donuts with a pastry from the vending machines. At lunch, he has a sub sandwich or burger with chips or fries, a slice of pie or cookies from the work cafeteria, and soda. For dinner, his wife prepares his evening meal. It's usually meat with 1 or 2 cups short grain rice, vegetables, kimchi, and usually some type of fruit. For his snack at night, it's chips, cookies, and popcorn. He does have some differences in his work schedule. He's either on days or the afternoon, and so his big meal is in the middle of the day whenever he works the afternoon shift. He has no food allergies, no previous nutrition therapy. His wife purchases the food and prepares it, and he doesn't take any vitamins or minerals. For his labs, his glucose is elevated, his ALT and AST is elevated, most likely because of some liver damage. His cholesterol is elevated and triglyceride because of his diet. His HDL is low, and obviously his LDL and VLDL is high as well because of his diet. His hemoglobin is high as well, and that's probably because of all the carbohydrates that he eats. So yeah, this is Dr. Meng. Miss Hey guys, I'm presenting on my patient, Mr. Meng. He is a 38-year-old male. He had a physical for his job, and the physician noted an enlarged liver and elevated liver enzymes, so he was referred for an evaluation. He is currently asymptomatic with hepatomegaly, which is the abnormally large liver, and elevated ALT and SAT documented 6 weeks ago. He has no significant medical history or surgical history. He doesn't take any medications at home. He does use tobacco and he occasionally uses alcohol. His mother has diabetes and his father has hypertension and coronary artery disease. He is in no apparent distress. He is overweight. His temperature is 98.7, his pulse is 77, and his respiratory rate is 12. That's all pretty normal. His blood pressure is slightly elevated at 142 over 86. His height is 5'8". His weight is 205 pounds. He has warm, dry skin with no jaundice and a firm liver with prominent left lobe and spleen tip, and he has no ascites, masses, or tenderness. So he does have the loss of functional tissue of the liver, and what the rest of this is pretty much saying is that they didn't find any evidence for any masses, tumors, or stones in the liver. His flow velocity is normal. His gallbladder is normal, and his spleen is enlarged. The pancreas is normal. He was diagnosed with hepatosplenomegaly, which is the enlargement of the spleen and liver, and hepatic steatosis, which is non-alcoholic fatty liver disease, and hyperlipidemia and hyperglycemia was noted. So his medical treatment plan was to repeat labs and ultrasound in 6 months, and he was referred for outpatient nutrition, for weight loss, and nutrition interventions for NAFLD. So the patient has a good appetite. He has his work schedule does vary. He can either work days or afternoons. When he works afternoons, his big meal is going to be in the middle of the day before going into work. For lunch, he usually has coffee with sugar and milk. At work, before lunch, he has donuts or some type of pastry from the vending machines. For lunch, he has a sub, sandwich, or burger, chips or fries, a slice of pie or cookies from the work cafeteria, and soda. For dinner, his wife prepares the evening meal. She does the shopping as well. He usually has meat, 1 or 2 cups short grain rice, vegetables, kimchi, and sometimes some type of fruit. For his bedtime snack, he has chips, cookies, and popcorn. He has no known food allergies, he has no previous nutrition therapy, and no vitamin mineral intake. For his lab results, his glucose is elevated, which means that he does have a high intake of processed food and carbohydrates, and his body's probably not utilizing the glucose correctly. He has a high ALT and SAT, and that kind of signifies some liver dysfunction or liver damage. His cholesterol is high, and it's above 200. It's at 285, which increases his risk for disease development. He has a low HDL and a high VLDL and a high LDL from his diet, and a high ratio of LDL to HDL. His triglycerides are high as well, which increases his risk for heart disease. And his hemoglobin is high, and that is because he is pre-diabetic currently.